This is Clara Haley. I'm going to be reading pages 45, 46, 47. Special instructions. Many medications have special instructions in addition to the dose, time, and route. These instructions are listed on the medication label and on the MAR. If you do not understand the instructions, ask your supervisor prior to preparing the client's medications. Plan accordingly if there are certain things that need to be done around the medication administration. Some examples include shake the medication well, keep the medication refrigerated, have the client drink a full glass of water with medication, have the client take the medication on an empty stomach or before eating, have the client take the medication with food, have the client take medication after eating, do not take the medication with certain foods, instruct the client not to eat or drink for 30 minutes after taking the medication. Have the client sit up for a half hour after taking medication. Crush the medication and mix it with food products such as applesauce pudding. Special circumstances in medication administration. Liquid medications. Liquid medications are a common way to administer medications. Liquid medications come in many forms: solutions, suspensions, syrups, and elixirs. The medication aid needs to be aware extra care needs to be taken when measuring liquids, and that you should plan on taking a little more time. Definitions. Solutions consist of one or more drugs dissolved in water. Suspensions are preparations of finely divided undissolved medications in liquid, usually water. Syrups are watery, sugary based solutions used to disguise unpleasant tasting medications. Elixirs, the medications mixed in alcohol solutions and sweetened with pleasant flavoring. People who are not taking alcohol should not take an elixir. When administering liquid medications, you must shake them well before pouring them. When pouring liquid medications, hold the label under your hand to protect it from spills. That can over time make the label hard to read. It is important to use the correct measuring device when measuring liquid medications. Never use household measurements or spoons such as teaspoons, tablespoons to measure medication doses because they are not accurate. Liquids are prepared in a separate cup from pills and tablets. To administer liquid medication, use a small, clear, graduate medicine cup with measurements on the side. Measure liquid medications on flat or level surface at eye level to make sure you have the correct amount. As an example, the medication cup in figure 3 is holding 20 milliliters of liquid medication. When giving liquid medication to an adult or a child, be sure they are seated upright or the head of the bed is elevated. Use an oral syringe and gently squeeze the medication between the client's teeth and their cheek, which allows them to swallow easier. Squeeze small amounts of liquid at a time, stopping to rest between. This allows the client to more easily swallow the medication and makes it less likely that they will spill it or get choked. Or syringes. If the dose is less than 5 cc's, the smallest measurement on the side of the perimeter medicine cup, you cannot get the accurate measurement using the medicine cup and will need to use an oral syringe. Also, a syringe needs to be used when administering odd amounts of medication, such as 8 milliliters, that may not be clearly marked on the metered measure cup. The oral syringe is made special to give liquid medications by mouth. It is a syringe that allows exact amounts measurements of the right dose. Oral syringes may have an off center tip or have a large, long, splendid tip that makes it easier to recognize it is an oral syringe and also to make it easier to give the medication. The difference in design of the oral syringe from a regular syringe help people give medications to tell the difference between the syringe used to give shots or injections and one used to give the oral medications. Many agencies have these special syringes made for administering the oral medications. Below are pictures of the oral syringe and bottle stopper that allow the oral syringe to withdraw the medication from the port. Examples of oral syringes are available for you to practice with the course. If you do not have access to a stopper, you may pour a small amount of medication into a plastic medication cup, then draw it up into a syringe until you get the accurate dose. To prevent contaminating the remaining medication, never pour excess medication back into the bottle. Dispose of the excess medication per your agency policy. It's figure 4 of these two pictures that I cannot see. Oral syringes, if the oral syringes your agency uses comes with a cap, be certain to remove the cap prior to putting the syringe in the client's mouth. There are reports of children choking on the cap. The person given the medication did not remove the cap prior to putting the syringe in the children's mouth and pushing in the medications and the cap into the client's mouth. For added safety, that goes on to 48. I'm stopping. I'm sorry. I can't find my glasses at the moment. I wear glasses, and my daughter keeps interrupting. Thank you.